now it really is my pleasure to welcome you to this, what I call, auspicious occasion. I want to take the opportunity to thank all of you and those of you in the audience that have so generously contributed to our program and continue to contribute over the years. And it is truly through your support and your continued commitment that we're able to offer this RN to BSN program and make a difference in our community. I want to thank the faculty here for their care and their contribution to the profession of nursing and assisting these students in the back to become the leaders in our community for nursing. And I also need to give a great big thanks to Miss Terry Hanlon, who is in the back, who she's the one that kept these students on track, whether they were here for 1 semester, 2 semesters, 4 semesters, whatever it was. Terry's the one that said, "Are you registered yet? Are you ready to get started?" And so we want to give her a great big round of applause, and she's just really the glue for these students, and as you can tell. The pin this evening that the graduates will be receiving identifies them as educated nurses, and it symbolizes for the many professional rights and responsibilities held by the professional nurse. So I want to congratulate you students, congratulate you nurses. You are truly the leaders in our community. And with that, we'll get started, and I'd like to introduce Dr. Mears to you one more time. He is the Vice President, again, as I said, for the baccalaureate programs. Dr. Mears?
Thank you. Good evening. Really, my heartfelt congratulations to each of you. I'm kind of here in place of Dr. Hafner tonight. Dr. Hafner is the president of the college, and he could not attend, but I'll tell you, his heart is in this program. He would love to be here, and if he were here, you'd hear an energetic, just a person that's so enthralled with this program. He was a big force in having it come, as well as Dr. Hesselberg. I've been at the college over 30 years, and I know that when I leave, people are going to forget about me pretty quick, and I really can't blame them, honestly. But what I hope they remember me is saying, wait a minute, wasn't he the guy that chaired that search committee where they selected Dr. Hesselberg as the dean? Wasn't he that guy? And you know, I was the one. I made the phone call to Dr. Hesselberg when I was at Cofer's You Pull It, trying to convince her to come here to the college. And she listened to the community, and she reached out in partnership, and when Dr. Hafner came, we were able to move ahead and get the bachelor's program in nursing to be a reality. And so I'm a numbers guy. My background's in mathematics, so I'm going to give you some quick numbers. 2009, 2010, 2011, so you may see a pattern. Then we jumped to 38, 26, 64, and that's as much as I can remember. All right, 2009, that's when we got the State Board of Education to give us the thumbs up to have a bachelor's program here. 2010, you may remember, because I think you actually started in the program back then. We started in January 2010, the first class, but you're the second class and part of the tradition that will continue here. 2011, you might remember, because you're actually graduating in 2011. And in fact, I think you're graduating tomorrow night, if I remember right. So this is real special. 36, that was the number of graduates we had last May. And 28 is what we have tonight. So if you add it up, 64 graduates so far. We've got a great tradition, have a tremendous faculty. My heartfelt thanks to them. Hopefully you'll get a chance to thank them in person tonight again. And you know it. You've lived through it. I've talked to a couple of you already, and you said, my word, was this a lot of work. And I know it is. It's intense, but my congratulations. And I guess I really should be speaking to the back row, because they're the ones. But thanks to the family and friends that helped supported you so far, too. Something very, very special. We've got 86 enrolled right now as we continue. We've got 41 new students that start in January. So we're going to continue doing what we've wanted to do. We're fully accredited by SACS. They said we were kind of a model institution, our accreditation body. Then the National League of Nursing accreditation team came. They loved us. They loved this program. They gave us the highest possible rating. And so we're doing some really wonderful things, and you're part of it, and we're very pleased with that. January, we continue our hybrid program that you've been part of, but we start offering an online program. So we're kind of reaching out, branching out, and so forth. And my thanks again to Dr. Hesselberg. She's been tremendous in her leadership for all that we've seen. All right, I need to be quiet because that keeps the program moving ahead. But I do want to introduce our keynote speaker tonight, and that's Elizabeth Lizzie Rigney. She graduated from a place called MCC, back with her associate in science degree, and of course that was our college name at the time, in nursing in spring of 2006. She then enrolled in our BSN program, and she graduated back in May. She was one of the 38, and she was the RN BSN Outstanding Graduate Award recipient. She works, like many of you do, many of the students here, at various hospitals right now. She's at Englewood Community Hospital, has been there for 11 years, and she told me tonight she's starting her doctorate program this August. So good for her. But Lizzie, come on up, and thanks for being here tonight.
There we go. Good evening. Congratulations to the back row. You guys are awesome. I'm so excited for you. I want to start tonight by saying thank you to you all for having me here today. I know this is a big, huge occasion for everybody, and letting me be a part of it is pretty special. I also have to say thank you to the doctors in the front row and Ms. Hanlon in the back for asking me to come. One of the things I definitely wanted to say tonight was, since I've graduated in May, I have to say that this program has been huge in all of our communities. I live in Englewood, but I also, do a lot of work in Venice and the Sarasota communities, and this program has made a huge difference. The 36 graduates that graduated in May are already out there, and they're doing great stuff, amazing stuff. So you guys are to be thanked for that. So Ms. Hanlon and Dr. Hindenlang called me, and they said, do you want to come talk to the BSN pinning ceremony? I said, absolutely, I would love to. And I hung up the phone and I thought, okay, what was I thinking? I do that every time. I go, oh yeah, and then I don't want to do it anymore. So I said, well, what can I say to this group of people that would make a difference? And to the back row, I say, well, I've been living the post-BSN lifestyle for 6 months now. And I kind of wanted to talk to you a little bit about what challenges lay ahead and what's going to happen in the future for you. The program was a challenge. It was a huge challenge. It was a lot of work. You missed your families. You missed work. You missed social obligations. And you missed sleep. I remember that. Remember that like it was yesterday. But the most important part is that you got here. You got here and you're here today, and that's a really special thing that's to be recognized. The most beautiful thing about graduating with your BSN is that this accomplishment transforms who you are. Certainly, the act of receiving the degree means something a little different to everybody. But a BSN degree also transcends personality, work situations, home situations, and places the recipient in a different category of nurse. A nurse that has the knowledge and skill set to perform beyond what the nurse ever expected he or she would. And with that knowledge comes new, exciting, and different challenges. So what does the post-BSN life look like? It's kind of fun, because you don't have to write papers anymore, or PowerPoints, we know those. There's still APA, though. I do have to say that APA is still out there. But it looks a lot different, too. It looks like a new direction, a new job for some of us, a new outlook on an already awesome career, a new confidence in with which to go forth. The BSN lifestyle looks like leadership. As Dr. Hesselberg was talking about, other nurses view you as leaders and organizers, and other leaders will view you as leaders and expect you to take on new positions of leadership. JFK once said, leadership and learning are indispensable to each other. The BSN has given you an awareness and understanding that generates and nurtures leadership. The post-BSN life also looks like active communication, and I know we hear that over and over in our jobs, but communication is very, very important. The competence with which you now practice gives rise to interdisciplinary cooperation and communication that provides the best possible care to our patients. The proficient manner in which you now communicate creates an environment where best practice is supported and nurtured. Your new skills in written communication mean that someday you may create best practice. Communication takes you everywhere you want to go. And the post-BSN life looks like knowledge. You now have the knowledge to create systems, fix what's broken, and the intelligence to change practice. If knowledge is power, then you truly have influence to create an environment of nursing that is good to patients and nurses. You will now take that knowledge, use it, to discover answers that are outside the box or undoable and problematic. The post-BSN life looks like responsibility, and that's a big word for tonight, but it's true that with great knowledge or power comes great responsibility. You're accountable to your patients, peers, your organization. You have a responsibility to apply research to your practice, and you have a responsibility to your peers to show them what evidence-based practice looks like. And the post-BSN life looks like professionalism. And of course, professionalism comes in all shapes and sizes. It can look different for everyone. Professionalism may look like joining professional organizations or the alumni organization at SCF or the Honor Society at SCF, sitting on committees at your facility. Professionalism may look like writing, research, technical improvement, creating performance improvement initiatives. However, however professionalism looks to you, practicing professionalism is part of the post-BSN life. But the post-BSN life is not all important and serious. The realization of this achievement should provide triumphant celebration within yourselves, in knowing what you have accomplished and the pride in your abilities. You are amazing, and the post-BSN life just might include a little sleep. It does, I caught up. In closing, I would like to extend, again, my deepest thanks to everyone for having me here. And I'd like to introduce Dr. Carrie Hockett, who is going to give us the RN BSN Outstanding Graduate Awards for this semester.
Okay, well, each pinning ceremony, we choose an outstanding graduate who, I'm gonna cry. Do it every time. Who has demonstrated rigorous and scholarly work that is just exemplary. And we have a certificate for that person, and their name is going on a plaque each commencement. And tonight I am pleased to welcome to the podium Krista Byler-Serline. Okay, our first graduate is Morvia Anderson. Okay. Morvia is an RN graduate of Excelsior College in New York. She currently works at Moffitt Cancer Center, girl after my own heart. My specialty is cancer care. Her plans after graduation including getting certification in her specialty and enrolling in the Florida State University Master's Program. Her biggest accomplishment that she has related to completing her BSN is learning more evidence-based practice and to implement that and teach others and to be a better nurse because of it. And Morvia has asked if she could address you all tonight with a few remarks, and so we're going to let her do that. Thank you.
Good afternoon, everyone. Congrats over there. Greetings on behalf of my colleagues. I am a graduate of the BSN program at State College of Florida, and I'm very impressed with the instructors who participated in my learning and my knowledge explosion. My career started as a home health aide, which progressed into a CNA, a certified nursing assistant, and later on I became an LPN. My ambition to gain more knowledge led me to become an RN. There were many obstacles which discouraged me from moving forward, and at that point, I gave up. One day, I met Terry, and she encouraged me to send my transcript, so I did that promptly, and I was accepted in the BSN program. It has been constant learning and interactions with my colleagues. All the professors have their gifted way of delivering their subject matter. But Professor Hockett and Professor Henenlang are teachers that will always stand out in my experience. They are very understanding, well-rounded, and accommodating. They were very supportive in the loss of my mother and gave me moral support. Dr. Henenlang hugged me and encouraged me not to drop out of the program, and she assured me that she will do all her best to help me to graduate. Even as a new student, she spent 1 hour the first day of class teaching me how to use the computer. I think she's a gem, one of a kind, that demonstrated to me that she wanted me to achieve success and not to fail. She gave me chances to help me achieve my goal. The director, Terry, was also instrumental, and she sent me emails and encouraged me to stay in the program. Dr. Hockett's energy, her knowledge, and experience is admirable, and I will say she's my mentor to go on. She makes the class fun and the learning consistent. She's also very understanding, despite her classroom rules, no computers on. I love her style and appreciate her and the knowledge she imparted to us. I believe SCF BSN program is very rewarding, and I hope many or all of my colleagues will strive to move on to a higher level in the nursing career. Thanks again for this awesome experience, and may God bless the teachers in their efforts to give back to us. My thanks also to Jennifer. Is she here? Charmaine and Pablita. These colleagues were very helpful. Jennifer came over to my house several times just to make sure I did my assignment. I really appreciate them in helping me stay tuned with my course. I wish for you all a greater career goals and God's blessing. Thank you.
All right. Our next graduate is DJ Anand. DJ graduated from SCF in 2010 with his AS degree. He is, at this time it says you're working at South Bay, but did you move to St. Joe's, I heard? So he's at St. Joseph's in Tampa now. His plans after graduation are to pursue a medical degree and become an internal medicine physician. His biggest accomplishment related to completing his BSN is that he is the first Haitian African-American male to complete an AA, an AS, and a BSN from SCF. Our next graduate is Krista Byler-Serline. Krista completed her associate degree in nursing at Kaiser College in May of 2006, and she holds a Bachelor of Science in Education from Youngstown State University that she obtained in 2000. She works at Sarasota Memorial Healthcare System in the CVICU, or Cardiovascular Intensive Care Unit. Her plans after graduation include having a baby in April. A boy, we know it is, yes. She's going to apply for graduate school in 2013 and try to complete a DNP program. She will complete a DNP program. Her biggest accomplishment related to completing her BSN are the degree helped her complete a research fellowship at Sarasota Memorial. The research class in evidence-based teaching reinforced key concepts needed to be successful with her own research study, which she has a poster of in the reception room, so please look at it. Congratulations, Krista. Our next graduate is Dewana Davis. Dewana completed her RN training at MCC in 2007. She works at Sarasota Memorial Healthcare System in the Neuro, is that 9 Waldemere, 10 Waldemere? Her plans after graduation are vacation, then resume my education, possibly a DNP program. And she says her biggest accomplishment is graduating. Our next graduate is Joyanne DeYoung. Joyanne completed her RN training at State College of Florida, and she works in an urgent care center. Her plans after graduation are to begin her career in the hospital setting in acute care. Her biggest accomplishments related to the BSN are that she feels good, that she continued to fight away to the BSN and finished rather than waiting. She's excited to be finished and spend more time with her husband. She feels like she can finally take a break knowing that she accomplished one of her biggest goals. Our next graduate is Sharon Eisel. Sharon received her initial nursing training in 2008 at then Manatee Community College. She is working as an RN case manager for Fawcett Memorial Hospital. Her plans after graduation are to breathe, take a year off, plan her daughter's wedding in November of 2012, and then go back to school for her DNP. Her future goal includes being either the nurse liaison for NASCAR or a pain management nurse in a hospital setting. Her biggest accomplishments are that after multiple speed bumps, family illness, death, shoulder surgery, emotional and physical, she's finally made it through.
I know Jillian Freed is here. Come on down. Jill completed her training as an RN at SCF in 2010. She's currently working at Patient West Surgery. And after graduation, she hopes to rest. We'll see about that work. And then some more schooling with the big question mark, maybe. Her biggest accomplishment related to the BSN program is that she or I did it. So congratulations, Jill. Okay. Let's go back. And how about Jennifer Izufu? Come on down. Jennifer became an RN through the SCF in 2009. She is currently working at Blake Hospital. And after graduation, she plans to soar higher. There are so many things I'd like to explore, she says. It is still cloudy up there, but I know that I cannot stop here. She says, my biggest accomplishment after completing the BSN is that I am graduating. Yes, it is a grand accomplishment despite my big habit of procrastinating. And through it all, I give thanks to God. I will also thank my family and friends for all of their support, physically, spiritually, and emotionally. Thank you to all. Our next BSN graduate is Tiffany Freeney. Come on down. Tiffany completed her ASN at SCF, then Manatee Community College in May 2002. She's been employed at Manatee Memorial Hospital for 17 years, 9 of which has been as a registered nurse on the labor and delivery unit. After graduation, she plans to study and sit for the GRE MAT exam for entrance into her next phase of advancement of nursing. She hopes to go on for a doctorate of nursing practitioner in the fall program of 2012. Her biggest accomplishment, she says, is in obtaining her baccalaureate degree in nursing. Thus far, I've learned so much and have a whole new outlook for my profession. I respect my profession more with this advanced degree and share my knowledge often with my peers, family, and friends. I would recommend that every nurse, if you're here and you're not in our program and you don't have your bachelor's, she recommends that every nurse be required to obtain their BSN and further on. Congratulations, Tiffany. Our next BSN graduate is Erin Jackson. Erin completed her RN at SCF 9 years ago when it was still MCC. She is currently working at Manatee Memorial Hospital in the labor and delivery unit. After graduation, she plans to continue her education and work toward a DNP, which is Doctor of Nursing Practice. Her biggest accomplishment, I quote, "I feel like there are numerous accomplishments in completing this degree. The writing and research skills have made me a better nurse. I have 2 kids and a full-time job. I had to fight for study time. I wanted a 4.0 and I did it. When I think of how hard I worked, I am filled with pride. When I walked out of the building after turning in my capstone board, I cried tears of joy. This program gave me the courage to go on." Congratulations, Erin. And our next BSN graduate is Brittany Johnson. Brittany got her ASN degree at MCC at the State College of Florida. She currently works at Take Care of Sarasota Home Care. After graduation, her plans are to work in an emergency department and eventually become a flight nurse. Her biggest accomplishment related to the program is pushing herself to continue her education. "I am a better nurse now," she says. Congratulations, Brittany.
All right, I will be introducing the rest of you up there. The first one, Susan Morgan. Susan became an RN at Manatee Junior College in May of 1970. She works at Sarasota Memorial. Her plans after graduation to continue working on the unit that she is currently working on, and it's a comprehensive rehab unit. Her biggest accomplishments related to completing the BSN were never giving up on achieving her goal. Okay, our next graduate is Mary Louise Roffles. She graduated from State College of Florida in 2007. She is currently working at Manatee Memorial Hospital on the Med-Surg Telemetry Unit. Florida Hospital. Oh, Florida Hospital. She's now working at Florida Hospital. I know, yes. Her plans after graduation, aside from switching jobs, was to pursue a DNP at UCF in Orlando. And her biggest accomplishment is graduating. Okay, our next graduate is Robin Walton. And Robin is a recent graduate of our ASN program. She graduated in winter of 2010. So she has been working very hard. She currently works at Complex Care Hospital at Ridge Lake. I hope that's still true. Her plans after graduation: relax for a week or so, then move to the ER and ICU, obtain appropriate credentials, and start on her master's in the fall. Her biggest accomplishments: I think learning more about myself and what it takes to really be a good nurse is what the BSN program taught me the most. A nurse can give great care and be loved by patients and families, but staying on top of current evidence-based practices is most important. Getting through RN training was really tough, but continuing to learn every day and continuing to broaden your knowledge base is the hard part. Okay, our next graduate is Bridget Wanetsky. Bridget also graduated from SCF, and she is currently working at Sarasota Memorial Hospital in CRU, Chronic Renal Unit. Comprehensive Rehab. Okay, what are your plans after graduation? And Bridget says probably continue on. Biggest accomplishments related to completing the BSN is her new job at SMH. Okay, now I believe we have one more. Is that correct? Yes. Takesha Washington. Takesha completed her training to become an RN at SCF in May of 2010. She is currently working at South Bay Hospital in Sun City on a telemetry floor. In the immediate future, she plans to continue working in the hospital as a floor nurse for a few years. She also plans to start a business that is centered around serving the elderly community. A few years from now, she would like to attend grad school to get her master's as a CRNA. One of Takesha's biggest accomplishments related to completing the BSN would be setting a positive example for her children through such a rewarding career, also being able to persevere through times of adversity. We also have a few students that were not able, or graduates who were not able to attend this evening. And one of them I know has moved out of town, has moved out of state, has moved way up north in the cold and snow. And so that is Deborah Albee, but she is also one of our graduates and regrets not being able to be here in the sunshine for a little while. In addition, some of the other students that were not able to attend tonight: Susan Haynes, Stephen Mazar, Joelle Sabino, Yelena Shebley, and Kimberly Washington. And I think there were a couple of other ones that we mentioned earlier: Sarah Del Grosso, Dawn Enix, Megan Fallon, and Lisa Ferrantino. I believe that's it. Is that right, ladies? Okay. And we congratulate all of you. We know it is a lot of work, but believe me, we all work right there along with you. But we try to accentuate your strengths and bring you along in those areas that maybe aren't quite your strengths yet, but I know they are all your strengths now as you're graduating. To family and friends, thank you so much for coming. Thank you for supporting them throughout the entire time that they were in school. And we know it's the friends, the family that graduate along with the students, because we know that you have had a huge part in that too. Now what we would like to do is to invite the graduates, who are now alumni, to an alumni meeting. We are beginning an alumni association, and that meeting will be right over here in room 135. And please do not disappoint Terry Hanlon. You guys have talked about how good she is and how much she means to you. This is one of our next steps, so please come on over. It's not going to be a long meeting, Terry has promised that, but we would like to get everybody involved. And then friends and family. We would invite you into room 117, which is the Selby Community Room. Some of you started out there and you saw some of the posters. So we would like you to go back to that room. The graduates will then meet you in there. And in addition to the posters, we will now have refreshments for you too. So please look at the posters and ask your graduates about them when they come back in, and enjoy the cake and refreshments. Thank you again.
We're here with one of the students that are being recognized tonight at the BSN pinning ceremony, Joy DeYoung, who is graduating with her Bachelor's of Science in Nursing. Joy, tell us a little bit about how you have changed your nursing practice since you've been in our program.
Okay. I'm really a lot more focused on evidence-based practice, looking into research and evidence to guide the things that I do, including infection control, just being a little bit more safe about that, hand washing, and patient care. Community health is a really great field, and I've really learned a lot about it, and I enjoy that.
Does this enhanced interest in infectious disease and community health at all relate to the project that you did as part of your program?
Yes, actually it does. I actually came up with a question as part of evidence-based practice on how cleaning stethoscopes with alcohol swabs reduces the risk of hospital-acquired infections, and actually found out that it's extremely effective, so it's a really good project.
So is this something we should be checking that our doctors are doing every time we go into the office?
It's really important to be cleaning stethoscopes because alcohol actually does almost take care of the bacteria on your stethoscope minus a few little things.
Okay, very good. So tell us, since you've been in the program, I understand you've changed jobs. So tell us a little bit about this new job.
I have, and actually Dr. Hockett's class helped me prepare as far as interviewing, but I have actually transferred to Charlotte Regional Medical Center. I'm working on a cardiac unit, and I'm really enjoying it.
So for somebody who's thinking about going back to school, what one piece of advice would you give them if they're a little nervous about doing it?
That's a tough one. Maybe not one piece, but just encouragement. It's definitely doable, and take it one step at a time, be flexible. There is an online route now, and blended. I liked blended because I could interact with the instructors. So just encouragement, not really advice. There's a lot of different things that are great about the program.
So you're glad you came to SCF?
Oh yeah, the staff is amazing. I really, really appreciated all their knowledge and instruction. Just really great.
Well, Joy, thank you so much for taking time to talk to us, and good luck with your career.
Thank you very much.
We're with one of our BSN pinning students this evening, Sharon Isley. Congratulations on this remarkable achievement.
Thank you so much.
Let's talk a little bit about the project that you did for your program, and I understand it's on compassion fatigue. What does that mean?
Compassion fatigue is something that any caregiver can get when you just care so much and you give so much of yourself and you forget about yourself. It's an opportunity for you to reflect on yourself and take time for yourself, because you can get severely burned out, and medical problems can happen at that point.
So what did you do in this project? Did you study a certain type of nurse or people? Who'd you look at?
I am a nationally certified hospice nurse, so I studied hospice nursing, and it is quite common among hospice nurses. They are known to care, as well as trauma nurses, burn nurses, ICU nurses. And we really, as nursing, need to look at each other and realize when someone is falling back into that pattern of caring too much, and we need to stop them and tell them, you know, you need to take time for yourself now.
Okay, so the old put the oxygen mask on yourself before you put it on anybody else, right?
Absolutely.
Okay. So I understand that you're a returning learner. So tell us a little bit about what advice you'd give to someone else who maybe has been out of school for a while, is a little reluctant to go back to school.
My idea is you're going to get older, so you might as well get older and smarter anyway. So go ahead and go back to school. I got my RN when I was 40 years old, and now I'm getting my BSN at 48, so you can always do it.
Okay, so become older and wiser at the same time.
Yes, absolutely.
And tell us a little bit about your future plans in nursing.
Well, I was a floor nurse for many, many years, working the night shift, and enjoyed that immensely. With this new degree, I was offered an opportunity to start into case management, and now I am a case manager for a spine ortho unit and also a surgical department.
So it sounds like this degree has given you job mobility and maybe a little bit higher salary?
Well, yes.
Okay, so it does prove that continuing your education does give you some continued job growth and opportunities.
Yes, it does. And I don't plan on stopping here either. I plan on going for my DNP and either becoming the nurse liaison for NASCAR or being a pain specialist for hospice.
Well, whichever way you go, good luck, and you've got a lot of stick-to-itness, so I'm sure you'll get through it. Congratulations. We're standing with one of our other BSN nursing students this evening, Susan Morgan, who is a returning learner to the field of education and nursing. And we're going to learn a little bit about, first of all, Susan's project. Tell us a little bit about what you focused your project on.
I focused my project on fibromyalgia pain. It's something that I know about because I have fibromyalgia pain, and I see a lot of patients coming through my unit who are in pain and have that as one of their secondary diagnosis, and I don't feel that we do enough to address it, and we throw pain pills at it when motion and activity with physical therapy would be most beneficial.
So less pain medication and more movement, maybe?
Yeah, more encouragement to get moving, because they need their pain medicine, but they also need to move and get their joints moving and the fluids in the joints, and it makes a difference.
Now, you mentioned your patients. Where are you currently practicing nursing?
I'm at Sarasota Memorial Hospital on rehab unit, so it kind of makes it easy for my getting people moving.
Very good. So tell us a little bit about why you came to the SCF program. What was so intriguing about it that made you want to go back to school?
I was really excited because I graduated in 1970 from Manatee Junior College in Bradenton on the Bradenton campus. And then after that, I kept trying for years to come back to school, and family issues and people, I had to take care of my parents, and they died, and different things like that. So it set me back and kept setting me back. And then I was going to Manatee Community College through USF. They had their courses on the MCC camp when Manatee Junior College changed its name. And then I found out I had stomach cancer, so I had to stop then. And then that was 6 years ago. And then I found out that Manatee Community College was going to be a 4-year college, and I was really excited about that. And I said, no more USF, I'm going back to my own alma mater. And I did, and I'm so pleased. And they've just been wonderful here.
Wow, so you've seen us through quite a few changes over the years, yeah. all the different acronyms, MJC, MCC, SCF, and who knows, when you come back for your doctorate, we may even be something else.
Could be.
So what are your future plans? Because it certainly sounds like you don't let anything get in the way when you've got your mind set to something.
Well, I'm interested in parish nursing. And I'm not going to be able to become a parish nurse, but I'm going to work part-time at Sarasota Memorial, and I've already started working with the parish nurse at my church, and I'm going to be visiting patients and bringing parish nursing as a voluntary position.
Well, anyone would certainly be very, very lucky to have such a compassionate person as a caregiver. Final question, why SCF? I mean, and it sounds like you're a good alumni, but what would you tell somebody about coming back to SCF to get their degree?
Well, there's so much that they're doing. They've grown, as I've discussed, and they've got vision for the future. And they're really behind you. You know, if you have any difficulties, they're there to help you with each step to make it through the program.
So good student support and good faculty.
Yeah, absolutely.
Okay. Well, Susan, congratulations this evening and tomorrow, and we wish you much luck in the future.
Thank you.
And we'll be right back. Jill Freed is one of our students being recognized this evening at our BSN pinning ceremony. Congratulations, Jill. We were just commenting on the fact that it's really nice to have that BSN, RN after our name.
I'm very proud of it.
Congratulations.
Thank you.
So one of the things that the students have to do is a project as part of the BSN program, and I really am fascinated by the skeleton that we've got here. So tell us a little bit about your project.
Okay, this project was about not having osteoporosis, osteopenia, and how the diet can affect it so much. And the need to have a high protein diet. The body needs it for healing and making white blood cells, but this is specifically so that you keep the calcium in the bone.
So diet will help you keep your bones strong and avoid things like getting your hip fractured and
bending over like this. Yes.
Okay, all right. So now tell us a little bit about the type of nursing that you currently practice.
I'm a nurse working at Coastal Orthopedic, the surgery center. So I'm working in pre and post-op and assessing the patients and getting them ready for surgery.
Okay, so you probably see some people who could have benefited a little bit from having known this ahead of time, right?
Yes, I can, yes.
So what are your future plans in nursing?
Well, I'm also a doctor of Oriental medicine, acupuncture physician, and massage therapist. So I have been in the healthcare field for quite a while, but in the natural side. Now, since I've got all this education on this side, I want to blend them both together and be like a natural health nurse.
Sounds like that's something that's sort of in still pioneering stages. Are you sort of going to be a trailblazer there in that field?
Yes, I am, yeah.
So why did you choose SCF?
Okay, it was right next door, basically, from where I was living. It is local, and I'm very glad that this situation worked out the way it did, because I love the teachers doing all of my prerequisites. This is doing microbiology, doing anatomy, physiology, statistics, psychology. All of this was so good with the teachers. They were caring. They wanted to make sure that I knew what I was studying and making sure I was retaining it. I got all A's, but it was because it was very good teaching, and it was the teaching. And then the nurses that we had, the teachers we had for the RN course, which was the 2-year, were excellent, but the ones for the BSN course are just superior. I was really impressed with them, and they're very good role models to follow after.
Very good. So tell us a little bit about what advice you would give to someone who is contemplating maybe going back for their BSN, and why they ought to think about coming to SCF.
Mostly because it's doable. And that's what I really liked about the whole thing. Terry Hanlon, who was the advisor, again, keeping me on track and everything, was very encouraging for it. And it was very good. It was a positive way of doing this to get me to stay in it. But it's doable. That's the thing. I have my full-time job, taking care of family, but this was doable.
Do you have more than 24 hours in your day?
Yeah, I think so.
Okay, so doable, and it sounds like a lot of good support and positive vibes.
I am trying to get my granddaughter to come down.
Hey, well, hey, you know what? We're always taking new students in our program. So, well, congratulations and best of luck in your future endeavors.
Thank you, Daisy. Thank you.
Brittany Johnson is one of the many students we're recognizing at our BSN pinning ceremony this evening. Congratulations, Brittany.
Thank you so much.
So one of the things that all the students have to do is a special project. Tell us a little bit about the project you chose and why you chose that topic.
Well, I chose to research lymphedema after breast cancer surgery because it's affecting so many women and it's actually increasing in incidence.
Okay, so my first question is, what is lymphedema?
Lymphedema, it most often occurs after breast surgery, but your lymph drainage from your extremities is blocked, and you end up having massively swollen arms that are actually disfiguring and debilitating. And there's no cure right now, actually. So prevention is most important.
So how does one prevent that?
Well, it turns out that education before surgery on how to prevent it makes the biggest difference. You just make sure to protect your skin and to wear special compression garments.
Yeah, very good. So now tell us a little bit about what you gained from coming to SCF and doing this particular nursing program.
Well, mostly I noticed a huge change in my nursing practice. I'm much more aware of what's going on with my patient, and I'm actually inspired to do a lot more in the future.
So tell us a little bit about what you do see as some of your future plans.
I'm most excited to work in the hospital and possibly in the emergency room. And before, I didn't feel prepared to do that. So
what is it that makes you feel more confident about doing something like ER? Because I would think that's probably a very high stress and you've got to be on alert all the time type of job.
It really is. This program talked not just about anatomy and physiology, but being a nurse in the big picture. And I feel like I have greater knowledge to help me get through the day.
So what advice would you give to someone who is contemplating going on for BSN and why they ought to consider SCF for their program?
Well, I think SCF is the perfect school to continue education. You just have to decide if you want to do online classes or come on campus, and then decide how many classes you want to take each week. So it's very flexible.
So what did you prefer, online or on-site?
I always prefer to come to campus because the lecture is invaluable and you can interact with your teachers a bit more.
And what else would you tell someone who might be a little unsure about the difference between online, on-site? How do you make the determination what works best for you?
Well, for me it was about motivation. I found it was a bit harder for me to get my work done if it was online. But I did learn a lot in those classes, but I found it much more interesting to have a lecture.
Well, on behalf of the college, congratulations, and we wish you much success in your future nursing career. Thank you so much for choosing SCF.
Thank you. It's been very good.
Erin Jackson is one of our newest BSN graduates. Congratulations. And so tonight we're going to hear a little bit about, first of all, what her project was for her BSN class, and then we'll learn a little bit about what some of your nursing plans are for the future. But first, tell us a little bit about your project.
Okay. Well, my project was bringing to light the fact that oxytocin is a high alert medication used in obstetrics frequently. Currently, in the past, they've been upping it at a level that's not quite appropriate to its pharmacokinetics. So in looking at my project, I really wanted to expand the rate with which it was increased and used, because it can be potentially a deadly drug to a mother and a fetus if used inappropriately. And obstetrics is my passion, so it came very easy to me, this project.
So what was your teachable moment? What did you learn?
Well, what I learned most was that I really wanted to educate my patients. I didn't feel like I was going to walk away from this changing every physician's view, but as I educated my patients on the medications that I was giving them and how they could be used for them and against them, that they in turn were able to empower themselves and really be educated on their birth process.
Okay, so you sound very passionate about what you do. Tell us, why'd you go into nursing?
Because I love to take care of people. I knew very young that I was going to be a nurse. So like third grade, I can remember thinking, I'm probably going to take care of other people. I think it's very vulnerable to be in a hospital bed, and especially in Manatee County where I work, we have a large Hispanic population, and I just can't imagine what it would be like lying in a bed, not being able to understand the language that your providers are speaking around you. So I really want to advocate for them and make sure that they're not being taken advantage of, and I love being a part of their process.
What do you see as one of the biggest challenges today for someone who's thinking about going into the nursing profession?
Well, everyone that wants to be a nurse, I tell them the same thing. You have to love it. This is not something that you're going to do because it's a paycheck, because there are openings. You read the magazines and they'll tell you that the baby boomers were going to have a huge nursing shortage. That is not a reason to go into nursing. You have to have a passion for it, or else you will never make it.
What did you find most helpful to continuing your education? I see that you've got quite a few family members here, so obviously you've got at least one other full-time job that you're doing in addition to going to school and working. How'd you manage it all?
Well, I mean, really the staff. I mean, the professors were overwhelming. Their patience, the way that they just walked you through it. Going into this, I was scared to death to write a paper. I never thought I would be able to do it. And I just remember my first class with Dr. Hendon Lang and her constructive criticism just really pulling me through. And then with every project, I got more and more confident. And Terry Hanlon was just always there to answer questions. They really, really made it user-friendly for the working professional.
So what advice would you give someone who is contemplating going back to school to earn their BSN and maybe they're a little reluctant?
Go. You will never regret one day of it. Enroll, do it.
And do it at SCF?
Absolutely. 100%.
Thank you so much and congratulations.
Thank you so much.
One of our newest BSN graduates is Morvia Anderson, who's here with us this evening, who's going to talk to us a little bit about her special project as part of the BSN program. But first, tell us a little bit about what you currently do in nursing.
I'm a registered nurse employed at the Moffitt Cancer Research Center. I currently work on the floor that takes care of melanoma patients. We give a lot of chemo and interleukin-2 to patients that have melanoma.
And so tell us a little bit about your project.
My project stemmed from a very bad experience that I had when my mother was sick in New York City. She was assigned to a floor where the nurse was too busy with too many patients, and my mother died when I was trying to tell her about all the signs that my mother was exhibiting. She died. So when my professor told me to do a project, I decided to do a project based on nursing ratios. And this is how I come up with this project.
So what did you learn as a result of your research?
I have learned that too many patients on your assignment is very unsafe. And we have already discussed this on my job. And this is something that I will stand up for.
Sounds like you would make a wonderful patient advocate.
Well, I am.
Very good. So tell us a little bit about your experience with the BSN program at SCF. What were some of the things that you found most beneficial about coming to a program such as ours? Because of course, you all are some of the pioneers. This is one of the first BSN programs that we've graduated.
Yes. Well, to be very honest with you, the teachers here are phenomenal. I can't begin to tell you what I think about the teachers that are here. They're very understanding, they're very laid back, they're very knowledgeable, they're very patient with us, they kind of push us to succeed. They have a wealth of knowledge and experience that I think help to run the program. I think they're very qualified, and I would recommend this program to anyone who wants to go on to do their BSN.
Well, very nice recommendation coming from someone who works at a very prestigious hospital. So thank you very much and congratulations.
Thanks a lot. You're quite welcome.
I'm here with Tiffany Freeney, who's going to take a few minutes to tell us a little bit about the project that she's done for the BSN program and also a little bit about what her future plans are. So let's start with your project, Tiffany. Tell us what inspired this.
I'm a labor and delivery nurse, and I chose the topic of how can we decrease the cesarean section infection rate. It's a growing problem at the hospital that I work in, and I just wanted to bring to light some things that would help decrease the infection rate.
So what was one thing that you discovered would do that?
Pre-op antibiotics and a skin prep prior to the surgery and multiple other things, but those are some of the key things that we should do. And we do at our hospital, but I just want everyone to know, like who is pregnant or having a baby, that these are some things that you need to pay attention to as well for your.
So nursing educators at the hospital get to hear this, but then patients get to know it, and that way they can also advocate for better care.
Exactly.
Very good.
Yes.
So tell us a little bit about why you chose SCF for your BSN degree.
Well, I graduated from SCF with my AA in 2002, and so when I always wanted to go back to further my education, but the closest school was Tampa, University of South Florida, and it was just kind of impossible for me to travel all the way to Tampa, and I was so excited that SCF decided to have a bachelor's degree in nursing. So as soon as I heard that they were having it, I jumped on board.
And you got to do it right here in your backyard.
In my backyard.
Very good. And now tell us, where do you work?
Manatee Memorial, labor and delivery.
And so do you see that your BSN degree is going to open up some other opportunities in terms of career pathways for you at Manatee?
Oh, most definitely, yes. And now it seems as though a lot of hospitals that you seek out, they're wanting nurses to have their bachelor's degree now, and which is awesome.
Well, congratulations for reaching yet another milestone here at the State College of Florida. Congratulations.
Wonderful. Thank you.
Krista Byler is one of our BSN graduates and participants in this evening's pinning ceremony. Congratulations.
Thank you so much.
So tell us a little bit about leadership styles and healthy work environment. I was particularly interested in this because we at State College of Florida do quite a bit of leadership training. So what prompted you to use this as a topic for your project?
I work at Sarasota Memorial Hospital in the CVICU, and I was chosen to do a research fellowship for a year, and my topic was leadership styles versus a healthy work environment as described by the American Association of Critical Care Nursing. So I was able to use that for my research class. And I was kind of comparing, there hasn't been a lot of research that linked the healthy work environment with leadership styles. So I wanted to take a look at that and see what there was out there. I learned a lot about the transformational leader, different leadership styles, and I felt that I had a lot of support at SCF through my professors in leadership training.
All right, you want some water? Okay, all right. 2, begin.
Krista Byler is one of our BSN graduate students, and one of the things that each of the students have to do is a special project, and hers is on leadership styles and healthy work environment. Krista, tell us a little bit about why you chose this particular project.
Absolutely. I work at Sarasota Memorial Hospital, and I have been doing a research fellowship as part of my job for the last year, and the topic was leadership styles versus the healthy work environment, to see if there's any correlations between the two. Healthy work environment's part of the AACN's. They have 6 standards that they describe as part of the healthy work environment.
So what did you find out is really most critical about the relationship between leadership style and work environment?
I would say that the leader that shows characteristics of being a transformational leader is more apt to have the characteristics of a healthy work environment in their workplace.
Now, you've been in this program now, you've completed all the degree requirements. How has your view of nursing practice changed since you've been in this program?
I would say that I'm more likely to go to the research and the latest evidence, to look for the evidence-based practice guidelines, to see what's the latest that all the different organizations have put out. If I have a question in my practice, I know where to go and how to find that information. I think the instructors here have helped me to find the tools I need to be a safer and better nurse.
So what do you hope to do in the future regarding your nursing career?
Well, I don't want to stop. I want to start. I'm looking right now into different programs. I hope to get my nurse practitioner and definitely my DMP. I don't know at the same time or down the road, but I definitely, within the next year, will be in a program to continue on.
Okay, well, best of luck to you in your nursing career, and thank you so much for choosing SCF.
Thank you so much.